Today we have Dr. Jason from Livv.
Thank you for having me.
So right now we are at a beautiful new space in Cardiff. So this is kind of a large endeavor that you've taken. But before we get into some of that, kind of what are your origins? Like what got you into some of the medicine stuff, and not traditional medicine, but modern medicine, we'll call it.
Got it.
And that can maybe lead us to where we're at today.
Yeah, so naturopathic doctor by trade. So 4-year accredited medical school that studies holistic medicine. So high school, dislocated my kneecap, tore my ACL. Obviously, I got into PT, physical therapy, chiropractic, acupuncture, and I just thought there was a better way.
Yep, there needs to be something more.
And then eventually I got into regenerative medicine, and this is where stem cells was growing in popularity.
Yep.
Kobe got PRP in Germany. It just started getting more popular, so I was like, oh, there has to be a better way.
This is the path. Yep.
So then I studied naturopathic medicine, and these guys were just gurus. It's like, hey, Hashimoto's, autoimmune disease, from cancer to longevity.
Right.
Then I was like, oh, this will be the future of medicine.
Right.
So fast forward 10 years, clinical practice. I got a location downtown.
Yep.
And then obviously gotten into peptides and ozone and EBU and IV ketamine and just doing all the progressive research of what's next, how do we heal toxic people in a toxic world?
Yeah, 100%, man.
Truly
100%. Yeah, love that. And that's part of it, is that, our ethos is about the level of care that we take and how we go about that, which is a little bit more of a deep dive, right? It's not just surface level, so the details matter. And that's where part of it is like the level of testing, part of it is the understanding of what all the testing means, which is part of the problem, I think, out there, especially in a traditional medical environment where it's very segmented and people can't kind of get this holistic view and kind of an overshot, that 30,000-foot view of their wellness.
Yeah, so how I look upon it now, it's the diagnostic testing. If you go to your general primary care, he runs a CBC, which is a complete blood count, and you can see if you have an infection. You can see, if you have an anemia.
Yep.
And then they'll run a CMP testing liver function, kidney function, proteins. And that's really, and then lipids, cholesterol.
Yep.
And that's pretty much all they'll run and be like, hey, it's normal. I typically tell most people, I'm like, your reference ranges are with average Joes. So me and you go out there and we're like, hey, your testosterone's 500, but the reference range goes up to 1100, and you're like, it's normal, I'm in the middle. Your reference ranges are competing against an average American, right?
Yeah. And it's like, that's for them to be sick or not sick.
Exactly. And then obviously, hey, 50% I think of the United States is obese, right? So then I'm like, all right, you're comparing yourself against a lot.
That's kind of pulling that average down.
The average goes down. This is where actually research goes with metformin, like, hey, metformin increases longevity.
Yep.
But when you actually look at it, it's like, hey, it increases lifespan, but 50% of America is obese, so their insulin levels are lower, but their glucose levels are through the roof.
Through the roof.
So obviously, hey, a little bit of metformin will help these individuals, right?
That's right.
Everything gets a little skewed. Where diagnostics is moving is hormones, inflammatory markers, viruses, bacterial, mold.
Yep.
People are all into parasite cleanses now. We can kind of deep dive into science, but pre-cancer screenings are going to be big.
Yeah.
MRIs, echocardiograms of the heart.
That's right.
Can you get diagnostic imaging and blood work that actually a practitioner gets to look at and be like, this is optimized for yourself and at your age and with your goals to live to 150, for
100%.
instance. So.
No, and that's kind of the bigger thing. So one of the things that we've seen, right, and just when we talk about, like with our world, which is, how do we optimize one's physical well-being, right? And with us, it isn't just the exercises. It isn't just a cold plunge and a sauna, right? There's other layers there, and the nutrition's a huge component to it. The lifestyle, behavioral, mental health components are a large component to it, which is why I think there's also things that, like, environment very much so matters, right? When we talk about traditional PT, it's like everything's white, stark. It's not inviting. It's not exciting. That's for sure. So we try and change that in our world a little bit, right? Now, obviously, that's something that's also very true to your heart, and you seem to have taken that to like even another level, right? So it's now you've created this place in Cardiff that will be more of a social wellness club for individuals who are really looking to optimize their well-being.
Correct. The model where I think things are shifting towards is, can you be around like-minded people? And then can you have a model where you're actually providing high-level luxury concierge medical care? And can you get all the modalities that you only got to think about health? Because when we talk about nutrition, everyone out there, I'm like, you've tried to lose 20 pounds, you try to lose 30 pounds.
Right.
Hey, my goal is to drink a gallon of water every day. All of these little things of, hey, New Year's is coming.
Yeah.
And everyone falls off and fails at some point.
Yep.
So can you actually have a model that we hold you accountable all the way through the process?
That's right.
You're getting your regular blood work, the comprehensive look at it.
That's right.
If you're doing shots, peptides, hormones.
Totally.
Your IVs, your massage, your body work, like all of it.
It's the guidance, right? The coordination, the quarterbacking, right? And I think that's what's different about when we talk about just regular medicine is more reactive. Right, you're calling them with a problem, and then they're trying to play detective.
Yep.
Right, we're obviously more on the front side of that conversation. We would rather deep dive when there isn't a problem, and then be able to say like, hey, these are ways that you can improve, because if you don't, that's where that could lead to.
Correct.
Right. So that's, for us, I feel very much so in alignment with the way that we deal with our clients, right? We don't want to be firefighters for those people, right? We want to be leaders. We want to be somebody who's providing guidance for them through that process. And that's the big part of it, is the community component of that. Because just as the environment matters, right? We are innately, we are animals. And with those animals, we need other animals, right? We don't live solo mission on our own. So we absolutely have to have some sort of community space. And I know that in 2025, this will be a fantastic community space in San Diego that has not been touched yet.
Yep. And I think the wellness space is just hitting the surface of, hey, people are thinking about their hormones. People are interested in peptides and stem cells, and their parents that have stored their kids' stem cells, they're like, how do I even
What do I do with it?
What do I do with it?
The doctor said it, I had to make a decision. What do I do next?
Exactly. So I think education, but trusted sources, which obviously from the physical standpoint and obviously the internal medicine standpoint, can we connect and think about how do we take care of the external body, like our biomechanics, our function, our flow, our physical performance.
Yep.
Because I have patients that I refer to you a lot that I'm like, hey, their mental health is decreasing and they want to get back into exercise. They can't get to their body weight, or they can't improve their cardiometabolic system without fixing a knee or a hip.
It's like holding them back, right? It's like this one thing, and then they try too much in the wrong direction, and then it makes them more like, hey, maybe fix me again, right? And that's where it's like more of a symbiotic nature of like kind of how we work with the yin and yang of the human body. But that's also because we also understand that there's more than one thing happening, right? And so that's why it's with these partnerships and with having an extension of our own business that actually allows, in my mind, to actually create thorough care for somebody, to where it's not necessarily about just the location or the modalities that they provide, because I think you're seeing a lot of that right now. I think it's more about the individuals that are doing them, right? What that looks like, the care that's being brought to the table, and then also the organization around that, so that there's an understanding around an individual and their well-being, because it's unique to that person more than anything else.
How I typically see, there's two types of people now in this wellness space. It's, you almost like piecemeal things together.
That's right.
Hey, I got my blood work, I got my micronutrient panel, I got my food allergy, I'm allergic to shrimp. And I'm like, I'm staying away from shrimp, but like, it still hasn't got me the result, because you're kind of piecemealing everything together.
Yep.
As quarterbacks, like you quarterback their care all the way through. Like, hey, my executive program is I take care of your physical body. We're running blood work. We have trusted doctors that can guide you through and understand what everything is at. Hey, if you're a 50-year-old male, your testosterone's at 300, your testosterone's low, right? How do we get? And I always tell patients, I'm like, I'm just part of your health team. I can lead decisions, but like, you are the most accountable for your health, right?
That's right.
And you got to do your part, and I'll do my part. And obviously, I always say there's a spectrum of patients. It's almost like investing. You can be really, really conservative or really, really aggressive. Yep. But the kicker of this conversation is sometimes if you go too conservative, it doesn't work because our world is so toxic.
That's right. That's right.
So I'm adapting to time and I'm adapting to what's out there in the world.
Yep. And this is a modern approach.
Yeah, for sure.
A modern, progressive approach. And I think that's the one thing that's also maybe some people are more tentative with, right? Because they're saying like, hey, where's the research, right? Where's the 20 years of this? It's like, well, there is not, right? That is for sure. So then it's like, well, what are the risks, right? And I think that's the beautiful. When we talk about stem cells, when we talk about PRP, when we talk about peptides, when we talk about these substances that are really like your body substances, and then there's a targeted approach with how we're doing them, the risk factors would actually be very low.
Correct. It sounds scary, right? You're like, hey, peptides, I'm injecting into my body, or stem cells. It sounds scary, but the world now is, can you raise levels or decrease levels of your body's own natural production?
That's right.
So your biochemistry and your physiology,
That's right.
Can you modulate them? And there are some instances where you inject synthetics and it's needed, right?
Totally. It's circumstantial though, right?
Yeah.
It's relative to where someone's at and also where they fall on the spectrum.
Correct.
Right?
Correct.
If they're super aggressive or more conservative.
And I think we both cater to both,
Yes.
right? There's need of antibiotics, there's need of painkillers,
Yes.
there's need of pharmaceuticals.
Yes.
But obviously there's way more need of the wellness components and the wellness modalities.
That's right. And that's one of the things is like being able to have a conversation with somebody, right? And having a business that allows that to have a conversation, to really understand what that level of care is and where someone's at in their journey, right? Because there's been a lot of people that we know that have had very terrible medical experiences and they've had challenges through that. And so it's like when they're introduced to this more progressive, like I would argue ours is a little more concierge physical therapy, right? Yours is concierge medicine. They're like, whatever this is, I want more of this, right? Because I've never had anybody actually care for me like that. And that in itself is healing.
Correct. And I think your trusted medical team, this is probably like 10 years of experience where I'm like, it's just trust.
That's right.
They trust Kyle, they trust me. If they trust me, they trust you. And it's like,
That's right.
As long as the community is so strong where you're taking care of the physical body, hey, they might need stem cells.
Absolutely.
Hey,
absolutely. We cannot fix everything. We know that.
Yeah.
Right? We know that. It's like there is always, I would say, we solve for about 85% of the stuff that exists out there. But after that, we got to have solutions. We can't just say like, good luck.
Yeah.
Right.
I think a combination and a partnership of me and you, we can heal 100% of everything.
Yeah.
Right.
Yeah. That's where it becomes special.
Yeah.
Right. And that's part of our goal is not to be limited in our mindsets and the treatment of our clients. Right. That's an important thing that we have to be progressive and we have to be innovative, and we have to put their best interest in play, because at the end of the day, like I don't make more money when they come and get stem cells and peptides. That's not the goal. The goal is that they get better care, they get healed faster, and that in itself is why everyone's shown up or should be showing up anyways, especially in the healthcare field.
Yeah, and I think to piggyback off that, I think parents are getting knowledge about how to take care of their own wellness and have a healthy lifestyle.
That's right.
So they can pass it off to the next generation.
Yep.
You know, I'm a recent dad and I'm like, hey, can I get all this knowledge and spill that into the kids?
Yes.
And then obviously, can they live a healthier lifestyle than us? Because they're only, if I say the world's toxic now, our kids are only going to live in a way more toxic environment than we ever have.
Yes.
Right? So meaning, here's the kicker in my head. I'm like, where's the research with 5G, 4G, LTE, satellites, Bluetooth, internet? Like,
no, all the EMF. Yeah, I mean,
we're constantly getting bombarded, right? Right now, we got cameras and phones. There's 25 Sonos speakers in this whole building.
I know exactly.
The electrical in this space is unbelievable, but it's like, what effect does that have on our bodies now?
We do not know. But that's why I say it's like you're almost like you're building something that would be combating a modern environment, right? We're not getting attacked by bears. We're not getting attacked by stuff. We're getting attacked by freaking plastic bottles and our cell phones and then like text messages and different light frequencies and things of that nature.
Pesticides in our food.
I mean,
I always say there's only a couple things, like our environment, like what you breathe.
Yep.
And then what you consume.
That's right.
And then obviously what your skin is kind of exposed to. But the biggest thing is food and water.
Yep.
San Diego's water's terrible.
Yep.
Do not drink tap water in San Diego.
Do not drink tap water.
And then obviously it's like there's a lot of mold. We're by the ocean, right?
Yeah.
So you see a lot of that. And then I'll run, it's called the tox burden panel. So like mycotoxins, mold.
Yep.
environmental toxins, BPAs, glyphosates,
Yep.
Roundup, pesticides,
Yep.
And then it runs heavy metals. If I run it on 100 patients, 100% of patients are coming back positive.
Something.
Something.
Yeah, there's something. So you can't not.
And you can't not. And it's like, hey, can your body detox in certain stages of your life?
Right.
And I think you're going to need that annually, right?
Oh,
and then can you build your body up? Because it's not like the old days where I'm like, hey, you're just going to have to eat clean sources of food because all of our sources are probably contaminated.
That's right.
Our water's contaminated. And now I'm like, all right, you can't combat this with natural means anymore.
Nope.
You're going to have to use bigger interventions.
That's right.
And I always say, like, you got to build you got to put an Iron Man suit on your body.
That's right. That's right.
And then you're battling through life.
That's right.
So
That's right.
that's what I do, and that's what Livv helps patients do.
Absolutely. And we've had that experience, right? We've had very positive, I've been in San Diego doing this for 20 years. And, I think this is the precipice of this conversation. And I think the problem now is that there's too many people that are doing it, quote unquote, whatever that means. But they're still commoditizing it. Right? They're not becoming experts. They're not becoming excellent. And that's one of the things that I think does separate our business, hopefully, and definitely your business, is that our goal is more on the excellence side of it. It's not on the commodity side of it. It's not a volume-based game. It's a quality-based game. And it's a care-first approach.
Yeah, for sure. And I think that's where I've done it, right? I was like, hey, let me try to get as many new patients as possible. And I got like 200 new patients a month. Right. And I'm like, keeping that many, the volume of 600, 700 patients a month, it's hard.
It's gnarly, yeah.
To hold that quality of care that you always wanted, right? Yeah. So I'm switching this model in Cardiff. It's a membership-based model where everyone is heavily invested financially and invested into their time and my team's time to take care of their life in their whole lifespan.
That's right.
If you're 50, so you're 6 feet under, and
that's right.
I'm going to try to make you live 100 good years. Quality years is the most important. Mm-hmm. Your mental, emotional health, your physical health.
That's right.
Your biochemistry in your body.
Yep.
And to make sure, the biggest one is to make sure you don't have to deal with anything catastrophic, because we found it first.
That's right.
Cancer, mold, heavy metals, autoimmune disease.
Which those are the ones that when they start to compound, you really can't do much.
Can't do much.
Right? Like when it gets too far down that road, you're just trying to hold on for dear life more. But it does require more testing. It requires some foresight. Right, it requires checking for stuff when you shouldn't need to be if insurance was talking, right? Checking for stuff, and I think one of the things is just to get it into a couple topics here. So when we start talking about peptides, right now, obviously we've seen peptides, we've heard peptides, right? I think a couple things that I want to speak to are quality. So how do we know where things are coming from? Like, I don't know where that is. I see stuff online. Maybe there's different prices, but they both said peptide. And then two, just like, what are some of the different ones and why would some people use them and how are you seeing them be benefited for some of your population?
Yeah, got it. Peptides is a huge topic. I think you're going to see a big wave even farther with peptides. Mm-hmm. But here it's like the biggest one, Ozempic, I think probably 50% of Americans have tried or are on Ozempic right now. So semaglutide.
Yeah, that's wild.
And I think people are going to get used to injections. Mm-hmm. Peptide space gets massive, right? It's usually athletic performance.
That's right.
So increases growth hormone, CJC, ipamorelin, Semeron has been around for 200 years.
Yep.
So people have been using that for quite some time. BPC 157 is the biggest anti-inflammatory peptide. I used to say, like, if you inject BPC, 20% of patients will feel better. And I'm like, the patients that you even refer over to me, I'm like,
right.
My bread and butter is PRP stem cells. Like, I can fix a shoulder. I can fix a torn pec.
Yep.
I can fix a torn meniscus. But BPC 157 is, I'd probably say 60, 70% with just using one vial.
It's amazing.
It's cleared up pain and inflammation out of a joint.
Yep.
Like that.
Bingo, bango. Yep.
And I think quality here.
That's,
The price points of peptides go from $20 up to,
a couple hundred.
A couple $100.
Yeah.
A couple $1,000 sometimes. And where you're getting it from and the sources that you're getting it from, I always say, you're injecting this into your body. You better get the best sourcing possible.
That's right.
I can't really say where and when and how peptides are getting sourced. But go to a trusted provider. Go to a trusted source. You're injecting it into your body.
Totally. Yeah. So I think that's the biggest thing is making sure that we understand not just what it is and not just who it is, but, it's like that whole where is it coming from and who's managing what? And that's where I think the quality of care goes through and through. Right. Now, when we talk about stem cells and, the things that I hear a lot about stem cells are going to be like some of the regulations that we have here in the US. And then some of the people that are trying to be more progressive on the aggressive side of the scale, looking at other countries to try and circumvent some of those. And how are you seeing some of that maybe change or ways that you've maybe found?
Yeah, so stem cells in the United States, it's not illegal and it's not legal and it's not FDA approved. So there's kind of this gray space with stem cells. Legally in the United States, if you store stem cells, practitioners can use them with a blood disorder or cancer.
Okay.
For joints, they're typically using mesenchymal stem cells from the umbilical cord. They'll sterilize it, they'll test it, they'll cryo-freeze it at negative 86 degrees Celsius, which is like almost negative 300 degrees. They'll cryopreserve that, but they're using it for a lot of different things. In the States, like I said, it's only technically used for cancer and blood disorders. But for joints that I've seen, I'm like, it's been a miracle biologic to inject into joints. So torn labrums, herniated disc, I've seen benefit. Torn meniscus, ACLs, PCLs.
Right.
Pretty much you name it in any joint, stem cells has a powerful effect. When you go abroad, so let's just say you go to Tijuana, which is in Mexico. If you go to Colombia, if you go to Panama, they're using embryonic stem cells, which some people are looking for. They'll actually take it out of the embryo, take those cells, process those.
Right.
George W. Bush said,
questionable.
He's like, I don't know about this efficacy. I don't know if I want to kind of dive down there. So he kind of put the X-nay on that research here in the United States.
That's right.
So, but quality and sourcing is important as well. So if you're going to Tijuana, Panama, Colombia, where are they getting the stem cells from? And here's a little bit of my knowledge that I've been seeing is typically when they extract the stem cells, it comes in, let's just say you get 1 billion stem cells, but they're 1 billion individual stem cells. What Mexico and just different countries are doing, or different clinics, they'll take one of those cells and they'll expand that in a petri dish. So now they're making 100 million out of one, or 1 billion out of one. Almost like the orca whales, almost like Shamu. Like, hey, they're taking his sperm and just replicating. So it's almost like that. So quality,
we don't know.
We just don't know if it expands.
We don't know. We
right?
can't know.
And then pricing goes through the roof.
It's all over the place.
Sometimes it's 2,000. Sometimes it's 5,000.
That's right.
Sometimes it's 20,000.
That's right. It's all over the board.
So come talk to us. I think we
exactly.
have
That's
we have
what I'm saying. It's easy to
space.
get lost. I think it's easy to get lost in the space, and then you hear from your buddies or your friends or whatever. And I think it's just let's stick with the experts on some of this that are in the field, that are immersive in it, because I think what could be good could also be bad if it's not regulated well and there's not some checks and balances across that.
The gray space in medicine is it actually helps cure a lot of things that your doctor, conventional doctors probably like, hey, I don't know, right? Like, hey, try this medication. We'll kind of see. But the gray space leads to side effects and a profile of, do I trust it? Do I not trust it?
Totally.
Just like anything in, any profession, there's the greats, there's the mediocres, and there's the not so greats. And you just got to find the right sources where the practitioners are doing their due diligence, they're mastering their craft, and they actually understand from experience how things ebb and flow through the human body.
That's right. And I think it's the experience that really can't be replicated, right? We have a knowledge base, but without experience, it's almost useless for the most part. And I think that's, one of the beauties that you'll find here with Dr. Jason is that he has got the experience, the expertise, but he's also got this really special environment that he's creating. And he'll, makes wellness fun again, where you're actually like looking forward to wellness, looking forward to coming to the doctor, which God forbid, right? And, it's beautiful. Like we have some fun stuff happening in 2025. So this is, Jason's 2025 for sure. He will be here rocking, doing that. So we're excited to see him grow and to help our team along the way.